So one of the things we like about Better Options is the small patient to nurse ratio, or resident to nurse ratio, and the care always seems to be emergent when it's needed. So it's something that doesn't happen in other facilities that we've witnessed, and it happens to be something that's really important to the parents of sons that need it.
When we looked at other hospitals, they had something like 12 to 20 patients to a nurse, and that means you don't get care for several hours when you might need something.
Or it could become critical. I mean, you can't have vacant points in care when you're saturating, and your oxygen's needed, and you need to have a care, and you just can't wait.
Right, and when our son's bell goes off that he's not getting enough oxygen, there's someone there in just a few seconds, and they're checking on him and suctioning him if he needs it, and getting him situated better.
And not only that, they care deeply about it. They're concerned about disrupting him and the nurturing of the patient and our son in this case, and it's important to us that he's taken care of with great respect, and he needs it. We are appreciative of the attentiveness of the nurse care here, which has been non-existent or minimally existent at other facilities. Yeah, well, his needs are met through a lot of very, I would almost say, loving care and awareness of what his needs are, specific. So he uses a device called an eye gaze to communicate, since he has what's known as locked-in syndrome, and he can only move his eyes. So in that circumstance, you only have the opportunity to respond with an up and down, yes or no for a down movement, with an eye. And that's something that we've grown to appreciate. The nurses here, we're willing to work with Quentin and to ask him questions, get him to become responsive, and respond to the nurses in a way that allows him to communicate. I mean, when you're in locked-in syndrome, you don't have a lot of communication because it's intimidating to most people. And so with our son, he's one that needs a little extra attention, and the nurses here will ask him questions. We'll deal with the issues and get him to respond more, which is helpful.
And every morning, they set it up and turn it on because we've asked them to. And we come in and it's on and ready to be used. One thing I like about this facility is the rooms have those lifts. I believe they're called Hoyers, that one person can lift our 185-pound son, 6'3", out of the chair and into his bed when appropriate and back.
And they're a permanent part of the room.
Right.
So they're not an independent thing, which has more...
Attached to the ceiling.
Yeah, it's attached to the ceiling. It's more... The other kind are more vulnerable to problems and accidents and such, where it's part of the room, it's part of the facility. It's just a higher quality care given here. The attention to detail here is, frankly, as high as it can be. It's certainly as high as it can be in hospital standard. So,
especially in Vancouver. There's nowhere in Vancouver that offers anything close to this kind of care.
The holidays are special events, not only for the holidays, but for the engagement of the family with the resident. And it allows us to interact and become more connected, which is important for family engagement.
All of the families.
All the families.
Meet together.
Yeah. So we get to relate to other families. We can talk to them about things and circumstance positively. It's always been positive around here because the care is such high quality. So it turns out to be an exceptional place to be.
They have a Thanksgiving party a week before Thanksgiving. They have a 4th of July party out on the gazebo in the backyard.
They do, or special celebrations of whatever it might be. But they're inclusive. They include everyone. and the families are welcome, the nurses are welcome, and it's a great way to see the nurses in a more relaxed scenario. So you get to relate to people on a more intimate level than just all professional. So it's great.
And last year during the Super Bowl, it was kind of a house Super Bowl party. The game was on in every room, and there was a bunch of pizza there, and we were screaming and yelling and just interacting with everybody. And it was just an extended family activity.
Yeah, it's important to be engaged at an intimate level with these high needs patients, and it's important. It's important to stay engaged as much as you can with your son in our case, or with other patients and their parents. Wow, yeah, no, the nurses here are exceptional, and it's critical that they are attentive and aware of what's going on with our son. They do detail things. They'll, if the Hoyer doesn't put him in the right part of the chair, they'll get him in the right part of the chair. If they move his head, which is important for our son, they'll get the details worked out to where he's as comfortable as he can be. And doesn't seem like a lot to a normal person, but it's a big deal when you can only move your eyes, in our son's case.
And the nurses are very understanding of us, whether we're fun or crazy or arguing or anything our family does. They're just so tolerant of us. And it's just a wonderful place to have to be,
I got off a plane recently and came here at
10 o'clock or
10:30, 11 o'clock at night, whatever it was, and it's not a common time for visitation.
Knocked on the door.
And they were open and ready to receive us, and of course willing to have us see our son. So it's important.
Out of town for a week.
Yeah, intimacy, connectedness, because our son's not living with us, and you miss that when you know he has such high needs. So you all furnish it, and it's a very special thing.
And when we've been on vacation, the nurses have been willing to set up a Skype situation so that we can look at him and tell him what we're doing and where we are, and turn the computer around the monitor so that he can see what we're doing.
Actually, as a matter of fact, we're about to take a trip, and we have been reluctant. Our son's had this injury for 4 years now, a little over 4 years, and it's hard to depart from him just because you're concerned about his care. And I'm more comfortable with this staff and these nurses and Faya, who owns and organizes the whole facility, because they're so accommodating of desire. So what that means in simple terms is when we're in Europe, which we're thinking of doing, we can have a communication with our son over an iPad, and we can be in another country and see that he's being taken care of, he's attentive, they're being attended to, and which is what you care about as a parent. In getting together on these special occasions where we have an opportunity to visit with the other family members, it's kind of special. The last one we were engaged with was incredibly special, where each family member shared something special about their experience with this facility and what they had done that was unique. For example, we had when our son went to the hospital, we had shared that when the nurses there were saying, "Where does your son reside?" because his skin is in such great care, he's in such good condition. And so I started bragging about Better Options and saying, well, it's, Faya Stevenson, it's Better Options, it's sort of the standard. And they're going, wow, this is exceptional care. So what happens is, when I was sharing this, that the nurses at the hospital were bragging about the nurses' care here, I thought that was worth sharing, and everybody appreciated it. And they all had a story similar to it in this last celebratory moment we were together, which was
Thanksgiving?
Thanksgiving.
You bet.
Yeah.
But when you go to the hospital and the wound care specialists come in first, and they roll him over and go, How long have you been at this place? 4 years, And they're going,
So
whoa.
what we didn't share is the ladies in the hospital know about our son for the last 4 years.
They know him. He comes in, Quentin, what are you doing?
Oh, yeah. And they hadn't
know?
seen him for 2 years, which I probably should share. We hadn't seen, he's been to the hospital one time in 2 years. I mean, which is a big deal when you're not breathing, when you're not moving, whatever. And it's a big deal to us because it's $1,000 trip and it's traumatic for him,
Yeah.
right? So that's a big deal to me.